This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan. Successful heart regeneration using metabolic enzymes. This is part number 45 in a 58-part video series of every chapter and subchapter. Please review our introduction video in our channel for background information on this book. The section we're going to is smoking. My grandfather was a chief surgeon at Rochester General Hospital until he retired. When I was a young boy, I remember looking through his vast medical library, and we found a booklet with a copyright date around 1910. It listed all the diseases caused by smoking. Some of those diseases listed included cancer, heart failure, heart disease, you name it. So when I see tobacco companies claiming there was no scientific data that tobacco smoking was unsafe, I know that claim is completely false. A study conducted in 2001 on causes for congestive heart failure among U.S. men and women concluded that 17.1% of persons with heart failure were smokers. That was 14 years ago, so they've long since died. Yes, smoking is fatal to someone with heart failure, and it is absolutely necessary to stop. You see, the smoking adds nicotine to your body, which stresses the heart significantly. Smoking reduces oxygen to the heart, which is already starved for enough blood flow. Carbon monoxide from cigarette smoke reduces the oxygen carrying capacity of your blood cells. The CO binds inside your blood cells to prevent oxygen release to your heart and lungs. Smoking constricts the blood vessels, reducing blood flow. It's like two hands around your neck choking off your oxygen. So besides the common tar and nicotine and lung cancer issues, it is deadly and causes sudden death for heart failure subjects. My grandfather, my grandmother, my uncle, they were all heavy smokers. My grandmother had to go through cancer surgery. She came out so disfigured I could not recognize her. My uncle, during his last days, was hooked up to a room full of equipment trying to keep him alive. My aunt did not even want me to see him. It was so bad. I lost both grandfathers when they were 62 years old. I often wonder what could I have learned from them if they had lived normal lives. So if you continue to smoke, there's not much I can say. It will be fatal and unlikely that anything in this heart failure recovery plan can counter the extreme damage being caused by smoking. It's your choice. Everything I write in this book is for survival and recovery so that you can live life to the full. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon in print and Kindle editions, from the Apple iTunes Store in an iBooks edition, from eBay in the print edition, and directly from the publisher, Wilkerson & Hughes, P.O. Box 777, Altoona, Florida 32702. Just send a check for $24 to cover the book and shipping. Thank you for listening.